and how do you use criteria to evaluate the content in the some of the sites online. So again, I start with key terms. I want you guys to be aware of this when you're going through the lecture, and of course, as you're reading. Decision support tools. These are like software programs that are linked to the electronic database, and they're used to make decision. It's kind of like the standard of care that are put into the electronic health record, and the practitioner uses it as they make their clinical decisions. And then you have the electronic health record, which of course, we're very familiar with, in the sense that, the hospitals are doing away with paper, so everything is online. And it's actually very helpful because you can use it to share information easily across disciplines. And of course, with a meaningful use, it's what does the hospital or the users, the end users, like hospitals, the physician offices and all that, it helps them to the incentive to use electronic health record by the federal government. Actually, I think it's Obama administration that put this into effect to encourage hospitals and doctors to use electronic for their data. That way it easily can be moved around from practitioner to practitioner. Then you have, of course, health information technologies, not just electronic health records. There are other things out there that actually help in the day-to-day care of patients, like telehealth, point of care equipment for taking finger sticks and all that. So, health information technology and information technology is how information is stored, documented, communicated, and of course managed. And of course, I've talked about point of care technology. Okay. So for health information, the electronic health system, the reason why this is actually that the federal government is pushing for this is that it reduces first of all, it's about costs, right? It reduces the cost that goes into errors that are made because something is omitted or not known when patients are being taken care of. So the incentive is to use electronic health record across the system because it kind of standardizes the care, especially when you're using clinical decision instruments. And of course, it helps with cost saving at the end. Right? It helps to contain cost. So some of the people that drive this will be the federal government, like Medicaid, Medicare, and of course, insurance companies. They don't want to pay too much, especially when patients move from practitioner or hospital to hospital and practitioner to practitioner. So the Institute of Medicine, they said that for electronic health records to be accurate or to meet the meaningful use criteria, the electronic health record has to collect health information. It has to have the ability for providers to put orders in. It must have clinical decision support instruments. It should be able to have connectivity and of course support patient care and education, and of course for billing and administrative processes, and for helping with population health management. So these are some of the core functionalities of electronic health record. Again, please take a look at it. It should be that when any hospital or doctor offices or even clinics and home care, if they're adopting electronic health records, that they should meet these 8 functionalities. Okay, so what is data management in electronic health record? So it's the ability for the data that we collect, that it doesn't end up either disappearing or end up in the wrong hands, right? So the electronic health record has to capture data in real time, and of course store it in a storage, maybe in the cloud, but it will be able to easily be able to retrieve it. And the only people that should have access to it are people that have already taken, maybe confidentiality classes and all that, so they would know not to mismanage it or to misuse it. And if there's any problem with, let's say we had another Sandy where there's no light and all that, that we can easily retrieve it, right? Or if the computer goes down, that we have another place where we can retrieve information and continue to take care of patients. They must be safe. In other words, it must be safe enough to prevent the selling or the misuse of patient information. As you can imagine, that's a lot of information if you get into the wrong hands, because people, social security numbers, date of birth, if you get into the wrong hand, a lot can happen. And the meaningful use, we already explained that the federal government, the goal of having that meaningful use is to improve quality of patient care, of course, the safety, to help patients to become, to have that health literacy, so they understand their disease processes and the regimen that goes with it. And of course, it helps improve care coordinations among disciplines. So the nutritionist, the PT, the OT, the housekeeper, the doctor, everybody is on the same level, knowledge, need to know level, how to care for this patient according to their discipline. And it manages the population and public health. So it's a good way to track, let's say, for instance, pandemic, the COVID traces will tell you that it's very helpful because the information from the hospital can easily be downloaded to them, so they can use that to help the patients as they go through the sequelae of the disease. And of course, to help to ensure the privacy and security of that PIA, the PHI, patient health information. So we're still meeting the guidelines of HIPAA and meeting the guidelines of confidentiality laws. So again, I talked a little bit about this meaningful use. The first stage is usually what we talked about. The second stage is about the continuous quality improvement. So the meaningful use help with also refining the care that we give to patients. To always go back and say, hey, did we do what we're supposed to do? Right? And then the third stage of it is adding support tools and quality metrics. These support tools and quality metrics are some of the standard of care for some of the chronic illnesses that are out there, like cardiovascular disease, normal delivery, diabetic care, wound care. So it's standardized across all discipline and across all practice setting. So what people are doing in Utah with wound is what people will be doing in Los Angeles with wound, is what people will be doing in New York with wound. So these decision support tools kind of, some people don't like it. They say that it takes away critical thinking from practitioners. But my argument is, who cares? As long as the patient is getting quality care, these are evidence-based practice that have been tested over time. So it's not like you're making mistakes. Right? So it guides it guides things like when should the Foley go in, right? It guides when should the Foley come out, because to prevent infection and all that. And for doctors and hospitals and clinics to qualify to get that meaningful use incentive payment, they must be, certified as meaningful use. The electronic health record they're using must be certified that it's meeting all these stages of meaningful use. So the decision support tools, we've been talking about it. So it's a way to make decision, to standardize decision. And also it helps the practitioner to know what to do. So it gives you alert. It tells you alert if there's any drug interactions. It gives you alert if there's any vital sign that is out of norm. It gives you alert when things are supposed to be done and it's not done. It takes reminders. By the way, remember the wound care has to be done today, kind of thing. The order entry is very important because it gets rid of some of the problem that nurses have been complaining all their lives. We can't read the doctor's writing, and so they can't read ours either, but it prevents medication errors. So physicians love it because they can be in their bed or in the golfing cars or whatever and put orders in for their patients. No longer do they have to come back into the hospital and write an order that nobody understands, and then their patient dies. So it helps in some of the issues to solve some of the problems that we see today in um, clinical sites. I'm sorry, I lost my mind there for a second. Okay, so with the HIPAA, again, I'm sure you guys, this is not the first time you've heard about HIPAA, but you know, when people think about HIPAA, they always think privacy, security, but that's actually not what HIPAA is about. It's actually the portability law, like the accountability and portability law, that if somebody loses their job or move from job to job, that they don't lose their health insurance. They can actually take it with them, right? So you went to the other job, right? And if, or maybe hang on to it for a couple of months while they're waiting to get another job. So that way they're not always hanging without insurance. But the part of HIPAA that concerns with electronic health information is the safety, the privacy and confidentiality of patients' data. It's always very, especially for my specialty, we're very anal and very paranoid about our patients' data, because these are some of the data that can make or break somebody in the workforce, in their church, in their day-to-day life, because people reveal to us things like abortion or STDs or some of the things that are very private as opposed to other discipline. So it's very important to safeguard data, especially data that is going into electronic, because if it goes into the hand of, let's say, some pirate from Russia or China gets it, it can actually be sold and put the patient in jeopardy. So individuals that do not adhere to this and dismiss us can be subject to criminal and civil liabilities. And again, I rather have civil than criminal, because criminal, you can go to jail. But with civil liabilities, they will make you pay depending on the severity of the privacy that you disclose. So always encourage your colleagues, and always be mindful how you what you do with patients' information. And PHI means things that you wouldn't even think about, like date of birth, their address, you know, things that will make that people buy in black markets, right? Social security number, even email addresses are considered PHI. So be careful. So the answer to this, if you really think about it, like health portability insurance, Portability and Accountability Act, it provides regulations to ensure that privacy and security of patient data is maintained, right? Of course, it has other provisions in there with the portability part of it. But the main thing when it comes to health information technology is that it's making sure that any data we put in there doesn't end up in the wrong hands. So what are point of care technologies? These are things you can do at the bedside with electronic health records. So things like having laptops or tablets or smartphones or PDAs as you collect data at the bedside. Many hospitals, very sophisticated hospitals, have actually passed that, where the nurse can go away, do her own thing, and patients don't call them by call lights. They call them on the cell phone that they carry around with them. And with the cell phone, they can get information, they can get through the charts. For nurses that work outside of the hospital, they can actually watch, you know, do medication reconciliation in their own home because they have access to these devices. I worked in a hospital where they have a robot, a real life robot that brings medication to the bedside. And instead of having somebody bring it, they will put it into the robot comes to the unit, and they will say, I am here for room 204. I need the nurse for 204. You come in, the pharmacy already gave you a code, you punch in the code into the robot, it opens its doors, you get your medication, it says thank you, and it walks away. It's amazing. So there are so many things that are out there, and I'm sure 5-10 years from now, you will see more. And I can't wait, because technology is fun. It makes life easier for practitioners and, of course, for patients. Then you have telehealth. Telehealth are a bunch. a lot of telecommunication technologies that are being used, especially now with COVID. They use this in home care arenas, they use it in group homes, they use this even as far as people that are very remote that doctors can't reach to them. And what it does is that it transmits health records electronically to providers to make decisions. And actually, we've had I work in a hospital where when they do x-rays, they will transmit the x-ray as far as China. They have a doctor in China that specializes in, I think I forgot the specialty, but his specialty is that, and that's who reads the the results to the doctors here so they can make decisions. So he is working a lot. I've used this um, when I was in charge of group homes. I've used it with not nursing home, not nursing home, home health, meaning community health, where I'm monitoring a woman remotely. She has the fetal monitoring attached to her stomach, and she turns it on and turning on the vital sign. And I can be from my home and monitor, read the fetal heart rate monitor, compare it to her vital sign, what's going on. I tell her when to get up, go to the bathroom, or get up and go to the hospital. So nurses are also doing this, and they're paying nurses a lot of money to telecommute, especially now with COVID. So it includes other things that we use that we don't think about, like peak flow meters and pulse ox and the scales and the glucometers. All those things, we're capturing data at the real time and putting it in, and it's helping our providers to make decisions, and of course, nurses. So how can we make this work? By making sure that nurses are equipped with all the information they need so that we can be on top of technology, right? So information literacy competency standards, it helps us to define and articulate the need that we need this information to take care of patients. And again, you would think, well, we don't do that. That's not true. Look at where you guys are. When COVID hit, most people say, oh, whoa, students won't be able to do hands-on clinical. Oh no, oh no. But I actually saw the silver lining, because not only did they force all of us, your professors, your schools, you guys, to become more cognizant of new evidence-based technologies that are out there for education. So it brought us back to the things we're running away from as nurses. So nursing, anybody graduating from nursing school now will say, oh, I don't know how to use computer. That's impossible, right? So it's a way of helping us to teach nurses how to mine the information. It doesn't matter that you're putting the data in, it's can you interpret it? Can you mine it? Can you use that data you put in to now take care of your patient? Can you use the data to explain to another practitioner what your patient needs, right? Do you understand some of the legal and the economic issues or even social issues that go behind the use of information, right? So it's important that nurses understand this. And I hope all of you are going for your bachelor's, because when you get to bachelor school, nursing school, this is what they teach you: how to mine data, how to analyze data. What do you do with it? Because I'm not mining it and analyzing it. You don't use it, doesn't make sense. So that's where we come in, learning how to use all that information. And it's actually evidence-based, in the sense that if you think about the standard of care, like some of the standard of care that is attached to health, to electronic health record, is actually giving you an evidence-based data that you need. So how do you evaluate information? Not every information that you have online is kosher, kind of. Most people that don't even that are not experts in their field have put things on data on online. When I'm reading online data, I know where to go. I usually go like Google Scholar. I go to anything that has edu at the end, because I know those are professors that are writing. So anybody that has an access to computer can put anything online. So read everything, be judicious, be careful when you're getting data online, because not everything there is researched or by authority, right? So I always look for, when I'm reading things for nursing, I look for nurses. When I'm reading things for law, I look for my professors. I look for law professors and stuff like that. When it's education, I look for educators. So because these are the people that have authority, they're objective, they tend to be very accurate because this is their work research, their life work, and they are very keen on being current. And of course, how do you use the data, right? So for instance, somebody like me, I write for nurses, and what I always talk about is, how do I apply nursing process? How will it help you, especially when you're teaching, especially when it comes to law? How will it help you as you go on in your practice? So when you're looking at these websites evaluated, I gave you guys this, it's also in your textbook. How do you, the authority with regard to the topic, who's responsible for it, who's writing it, right? Who is it objective? Did they have a statement of purpose? They have, do they disclose anybody that is giving them money? Because then you want to know if it's biased. How accurate is it? How current it is, right? So for me, anything that is more than 5 years is not current anymore. I would take anything 5 years, but more than 5 years, kind of pushing it, unless if it's classical paper, like classical information. Usability is, how is the site? Is it stable? Is it well designed? Is it easily to maneuver? Can you read it? Can you get the information? Is it error free? Is there anything that links it back to the institution or the organizational homepage? And is it reliable? So those are the things you look for, because you can get to a website where you think it's legit, then you start looking and you be like, it's not, because it doesn't have any sponsorship, it doesn't have anything that makes it objective. And then you assigning some of 1, 2, 3 points to these information, and then you're going to rate it. Anything that is 5 to 9 is poor. Stay away from there. Anything 10 to 14 is fair. You can basically use it, but maybe not in scientific argument. 15 to 19 and 20 to 25 are excellent, good. You can use that. It will help you as you navigate for the information. So if you're looking at this, the nurse preparing presentation is reviewing websites to collect information. On one side does not contain headings, doesn't contain hyperlinks, which criterion to establish reputable website is missing. So if you go back to what we talked about, the authority, who's writing, right? If the URL is, does it have a reputable affiliation, then that's authority, right? So if you go back to our question, yes, authority, the website is missing, that's, you have to question that. Okay, so the exciting trends, and I'm actually very excited about this because I really love technology. The reason why I love technology is not for anything, it's just that it helps to kind of prove some of the things we've been always been doing for patients, but either we fail to write it, or in some case, somebody like me, I'm very lazy when it comes to writing. I prefer typing. So most of us haven't really taken credit for some of the things we do for patients. But with technology, it has helped us to improve the care we give. It has helped us to bring care to patients that wouldn't normally get the care. It has helped us to communicate our findings. So I was researching something. I actually had communicated with another professor in Russia. We didn't understand each other, but we had communication too that was translating things for us. So it's easy, you can get to the authorities easier now instead of writing letters, sending email that people don't read. Another thing that I'm very interested is gaming. I love mnemonics. I love gaming, things that will help me to remember things. So that's my new research, by the way, that I'm working on. How do I use gaming to teach things, especially OB? How can I use gaming to teach cardinal movements? How can I use gaming to teach different the different phases of labor? How can I use it to teach postpartum care? How can I use it to prenatal care? So there's so many things that are still coming out, and nurses are in the forefront. Our nurse scientists are actually researching some of these things, so that 10, 20 years from now, the way we practice nursing is not going to be the same. It's going to be awesome, I think. Hopefully I'm still alive to see it, but it's going to be one of those times, you know, if you watch the Jetsons, you guys are still young to remember the cartoon Jetsons. It's as if we're breaking boundaries in what we can do when it comes to healthcare. And there's so many things out there. So I'm excited about it. And it will also make our life easier. Okay, so that's the end of it. I hope it will help you guys. I forgot to tell you guys in class today that I will send you your quiz. You're going to do it outside, you're on your own, and then I'll give you time. So we will do this before next week, because next week is our exam. So what is in the quiz? Everything we've talked about from the day of the exam, right? The leadership, communication, health information, those things. And of course, it's open book. So how hard can it be, right? Okay, so we will talk. I will see you guys next week.